Hi everybody. So today I'm going to do the third part of the series on reversal of heart disease. The first video I talk about what heart disease is and what the conventional treatments are and why they don't work all that well. The second part I discussed all the causes of heart disease and how exactly they go about causing heart disease. So now in the third part, if you haven't watched those two, please go back and watch the previous two videos. But otherwise, let's get on with the show. So today I'm going to talk about reversal of heart disease, and by the way, the same thing will work for prevention as well. It's not just about reversal. So we know the causes of heart disease: high blood cholesterol, too much of cholesterol in the diet, too much of saturated fat in the diet, high blood pressure, smoking, sugar, refined foods, emotional stress. So why don't the traditional cures work? Because what we are doing is this: if you have a sink which is overflowing, what we are doing is mopping up. We are not going and turning the tap off. So what is recommended by the system which we are proposing to reverse heart disease is to turn the tap off so that you don't have the heart disease problem. So like I said, what happens if we actually address the causes? And this is a guy called Dr. Dean Ornish, and he wrote this brilliant book called his program for reversing heart disease. Please note, it's the only scientifically proven system to reverse heart disease without drugs or surgery, and it's proven. There's results published in the Journal of the American Medical Association. So it's not just snake oil; it actually works. The best part is he published this in 1990. Can you believe it? 30 years ago. I'm still amazed why people are not following it and avoiding all the problems related to heart disease. I highly recommend this book. Even if you don't have heart disease, please buy and read it. It will give you a lot of insights. So what is the program that Dr. Ornish recommends? No smoking, almost exclusively a plant-based diet. I think he allows small amount of yogurt, but it's pretty much identical to what we are suggesting in the series of videos. Mild exercise, yoga, meditation to handle the stress part of it, and the group therapy and the stress management. That's it. It's pretty simple, pretty straightforward. What were the results? You will be amazed. Within a month, they could measure increased blood flow to the heart and overall improvements in the heart's ability to pump. HSCRP, that's a test that measures inflammation of the coronary arteries, especially the coronary arteries, is restored almost normal. In a year, severely blocked arteries began to improve in most of the patients. Overall, the average blockage is reversed from 61.1 to 55.8%. And more severely blocked arteries showed even more improvement. But remember, it may not look like a big number, 61 to 55, but even a small amount of reversal in a severely blocked artery causes a great improvement in blood flow to the heart. In the long term, after 4 to 5 years, there was even more reversal than seen in the first year. The angiogram showed that the arteries are even less blocked. There was a test group, and in all but one patient, the progression of heart disease either stopped completely or it began to reverse. That's quite amazing for a simple system that what he's suggesting. So in a nutshell, the majority of the patients reverse their disease, they become symptom-free, pain-free, and they could resume their lives largely free from medication. Of course, like I said, the important thing is you can't just go about and do this on your own. And there were many people who were actually recommended for bypass surgery or angiography stents, and under the doctor's supervision, they tried this instead, and they could avoid the operation. So it could happen. It could be the case with you as well. So just consider it before just rushing into the operation theater. That's what I would say. Consider it. You might still go for the operation, but consider it. Many years later, another enlightened doctor called Dr. Caldwell Esselstyn came up, and he said, okay, let's forget the yoga and the meditation and the exercise. That's an optional. I mean, you can do it if you want. But what happens if we just fix the diet and we go completely plant-based? So, Dr. Ornish allowed small amounts of yogurt, but he says no, completely plant-based, and a few other recommendations. Again, I highly recommend this book. Please go ahead and buy it if you have, or if you or your loved ones have or are going to develop heart disease. He's pretty much the same system, but purely I'll discuss that. But a plant-based diet. So as you can see, the plaque on the arteries, it kind of melts and it reduces, and then the artery opens up and the blood flow greatly improves. And this is not science fiction. But they've done PET scans and they actually show before and after. As you can see, how the blood flow in the artery has actually improved. And this is another very dramatic coronary angiogram, which shows on the left-hand side, you can see how the artery is constricted and how the blood flow is awfully impacted. And within 3 years' time, or less than 3 years' time, you can see it is much more re- return to normal. And there are other people. There are people actually. Dr. Esselstyn talks about a guy, a 74-year-old person called Victor Carpencourt, who had severe blockages. Bypass surgery was recommended. He had pain even with slight exertions. After following the system, he now climbs 130 floors every day on his exercise machine. That is equivalent of going to the top of the Empire State Building every single day. That's how magical the system is. And there are other beneficial side effects as well. Your high BP reduces, your cholesterol reduces, your weight goes down, energy levels go up. So it's all a healthy diet as per Dr. Esselstyn. And what is a healthy diet? As you will see, I will talk about it right now, and you can see it's pretty much similar to what we are talking about in this series of videos. The first thing is, of course, set aside all animal products. No meat, no fish, no eggs, no milk products. Avoid vegetable oil. Oil is not good. We've discussed. I have made a separate video about oil, in fact, why it's not good for you. And focus on whole grains and whole foods, fruits, vegetables, and nuts, seeds. Not nuts. He doesn't recommend nuts, but lentils, pulses, but whole, not refined, not white rice, unpolished rice, not white flour, whole wheat. And avoid nuts. Dr. Esselstyn doesn't recommend nuts for people with a heart disease because they're high in fat. And he recommends certain supplements. I don't want to go into all the details. I can't. It's a full book. I can't compress it into a short video like this. Please buy his book and read it. So, to summarize, by either following Dr. Esselstyn's system, which is only a plant-based diet, or Dr. Ornish's system, which is the same diet plus some exercise, yoga, meditation, and group therapy, you can reverse heart disease. Needless to say, under the close supervision of your doctor. You have to do this. You can't do this on your own by reading a book or watching a video, because your medications have to be managed, and you have to be carefully monitored. Any problem, you have to take immediate action. It's a matter of your life. You can't play around with it so easily by reading a book or referring to a video. You have to have actual, real medical supervision, expert medical supervision. So, but not just for reversal, you can prevent it if you follow all these things that we're talking about in this series of videos, or in Dr. Esselstyn or Dr. Ornish's book. You won't have the problem in the first place. So there's no question of reversal. So you just think, if you follow the system, you don't have to have any of these things. And like I said, this is the same system that what I'm with some minor variations, what I'm recommending in this series of videos. So that's how powerful it is. It's never too late to start. If you think this makes sense to you, start today. Thank you.